COVID-19 case numbers in Africa dropped by 35% in September. Nearly 1,800 deaths were reported across 34 African countries in the same period, according to the World Health Organization. The Ugandan government loosened its anti-coronavirus restrictions as the COVID-19 transmission rates declined. For more insight, Africa 54 Technology Correspondent Paul Ndiho spoke to Dr. John Mundaka, an obstetrician and gynecologist at Sebbi, a small private hospital that's leveraging technology to provide medical care to COVID-19 patients in Kampala, Uganda.
John Mundaka, welcome to Africa 54.
Thank you, Paul.
We've been dealing with this COVID pandemic as a consultant working for a medical facility in Uganda. What are some of the most challenging things you've encountered during this period?
As a facility, we've been attending to a very highly densely populated community that can't afford most of the medical services. And the facility came in handy to offer most of the services at low costs. However, the treatment partners for COVID, the requirements for treatment are already at a high cost, finding it that most of our patients could not afford. So we had challenges offering the services at the expected low cost to the community. We were hit with a high demand of oxygen, and the supply in the country was down at a very high cost for the little that we could get. And yet we were determined to offer our services to our community at the lowest possible cost.
Despite the challenges, you guys have been able to get up every day, go do your jobs, and do it at the highest level, or perform at the highest level. What keeps you going?
Well, the selflessness and the commitment to serve to our community that has a huge demand. Most of the communities we serve are our friends, our relatives, our neighbors. It so happens that we are in a community where we've grown up. This hospital has been constructed with support of very many members. Hinga, the CEO himself is a doctor, a colleague of mine called Dr. Sebbi, who is born where the hospital is. So what pushes us moving is that we can't go away from serving our own. The demand is there. Some of them are relatives, so they have come, and we have found ourselves not being able to send them elsewhere.
How much of a role did new technology play in you guys staying afloat during COVID? A lot of hospitals, even here in the United States where I am, struggle. To this day, they're still struggling because of the overwhelming numbers of people who showed up. A lot of them died as a result of not getting the medical care or the treatment that they deserved or wanted. How did you approach it on your end from the resources that you had at your disposal?
The COVID crisis came in at the time when we had transferred from a small facility to a new facility that we want to again add a voice to our appreciation of Hinga, Uganda, that managed us to build a hospital with an advanced technology, the technology that had monitors, the technology where we had pipelined oxygen flow, and we had also a different computer to help us with the health management system. So that, in a way, helped us to create an isolation unit for the highly infectious patients, away from the other usual patients we've been attending to. It also enabled us to use a limited number of oxygen cylinders, but supplying to a number of beds. So you find that, yes, the technology helped us coming in timely to offer the overwhelming demand of service.
Your relationship with Hinga, where do you see this relationship between you and this technology firm taking you?
The partnership comes in a way that it's going to allow us offer the need or the service that is required by the community, which is really very underprivileged or low privileged. There are very few centers that can carry on services like CT scan services in our community. Actually, there are only about 2 or 3 in the community that we serve. And in the community of Nansana, we're going to be the first to offer that demand that is required. We want to appreciate the platform that has been offered to us by Voice of America. Helps us to discuss our challenges and help us to invite a number of different partners and support from the different communities to our low underprivileged community in Africa, Nansana community in Uganda.
Thank you so much, Doctor.
Thank you very much, Paul.
And thank you for watching Africa 54. Good night.